Hello everyone, my name is Jillian and welcome back to another video on Post-Surgery Care of Atlanta YouTube channel. And my name is Jillian and I am the owner of Post-Surgery Care of Atlanta, where aftercare matters the most. So this video is going to be about skin health. Um, and the reason why I wanted to do this video is because so many of you all are told about, garments and fajas and um, what Ted holds. There's different things, and making sure that you lose the weight that you need to weight, knowing how. I mean, there's so many different things that you all are hearing about, but I'm not really getting a lot of videos about skin health. And we have this, the largest organ of our body is our skin. And it's, there's really no way that we can get new skin, manufacturing. There is thing where, they can do skin graft or anything, but that's pretty painful. So we want to take care of the skin that we have. If we don't ever have surgery, or if we do have surgery, you definitely want to have the proper education in in learning how to care for your skin before the surgery ever comes up. If it's elective or medically necessary, you want to have a good baseline on the things that you want to start implementing in your daily routine or regimen in caring for your skin. And many times I look on YouTube and there's a lot on about skincare, about makeup, making sure you have on your couture and different things. But I'm going to be more so focusing on skin health for as in the entire body. Preparing for surgery, or if you're not preparing for surgery. So this video is just a baseline. I'm not going to go super deep, but I wanted to raise the awareness of the importance of taking care of the largest organ of our body, and that is skin. So the first thing that I want to say is that the products that we're using, you want to make sure that you're reading the labels on the back. And the reason why I say that is many of the popular ones that many of us have used in the past or are using, they're filled with a lot of alcohol, they're filled with a lot of water, they're filled in with a lot of mineral oils that really is not nourishing the skin, just on a daily basis, because our skin is going through so many different shock moments. We hit our skin when we're getting in the car, getting out the car, when we're working. Depending on type of line of work that you do, you may do construction work, you may do, healthcare work where you're with patients and patients are attacking you, and just this all different types of things. And so is we want to make sure that we are using products that will be that will be feeding into our skin to nourish it, to promote elasticity, that's going to promote collagen into our skin to keep it together. If it does get cut, it's easy for it to, heal again, or make it where it's not so easy to be cut because it's highly moisturized and not dry. Um, and we really want to be careful with that. And these products I have used personally. Just put this disclaimer out here: I am not being paid to promote any of these products, but these are just from my personal experience that I have used. I have used Dove, I have used Nivea, I have used this one product that I'm currently using now. Is I shop at Sam's, and it's like this, it's like two containers, it's like $9-10, but they're really big, and they have like three different oils in. They have cocoa butter, they have shea butter, and then also um, um, yopi, yokio oil butter. It's like three butters in one. And so it is amazing. I mean, truly, it is amazing. And it has like this almond oil that's mixed in with it. And so it moisturized my skin very well. And I know that some of you all may suffer from sensitive skin. So you definitely want to be reading the back of the labels to make sure that is this going to enhance my skin health? Is it going to, give me the protection that I need for my skin just on a daily basis? And so you want to look at the labels behind your body wash and your lotions. Um, I've been using Jared lotion for the longest. I've used Nivea lotion for the longest, Dove lotion for the longest, and all three of those work very well. And I will tell you, I used to use like the Vaseline cocoa butter or the Equate. I know about that. And I now see a difference in my skin when I'm using the more higher grade level of body wash and body lotion, that my skin is moisturized longer throughout the whole day and even to the night. So I don't have to use as much. And the ingredients is feeding into my skin, is nourishing it. It's not where it's just like a top glaze and then it just absorbs it, and then it's like I didn't even put lotion on my body. So you want to be very cautious on what type of body wash and body lotion that you use on your body. And I know many of the bubble baths, I don't know how many of you ladies are using it, and even guys. I don't want to exclude my guys. Men, you definitely want to be careful as well in body washes that you use, because you want body washes and lotion that's going to nourish the skin. We want really great skin health. We want to practice it and implement products that's going to promote the skin health in a positive way as much as possible. Um, the five layers of skin is epidermis, hypo, and dermis. And pretty much everyone knows that, but I just wanted just to bring that in just so you know that there's three layers of the skin. And the function of the skin, just give you just a backdrop, is that it provides protective barrier. It prevents moisture loss. It prevents UV effects or radiation from the sun, from where we don't get burns as bad. Sunblock is great. Definitely recommend to use that on the skin as well. So we can prevent having blemishes, some of those brown spots that come up. Brown people, African American people, people of color, we can also burn. We can also have those egg spots that come on our face from the sun. So I highly recommend that you use sunscreen. I use the 70 SPF. I'm a lighter shade, so I definitely like to bump up my SPF. If you're a darker shade, you don't have to go as high. You probably can go like a 30, 40, and you'll be fine. But if you are lighter skin or Caucasian, you definitely want to bump up your SPF on your sunblock, and definitely use it definitely in the areas where you're going to be exposed, like your forearm, your neck, your face. I use like the spray one because it works better, and I just work it on my skin, on my arms, and it absorbs, and I feel protected when I go out. So the next thing is skin helps with regulating temperature in the body, um, and 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 also it acts as a sensory for touch. Like we get sensory of pain, we get sensory of tickle, we get sensory of different temperature. Oh, that's hot, that's cold, that's pointy. So the skin have so many different functions that we need it to be functioning at its highest capacity as much as possible. And so when when we have done all what we need to do before having surgery, perfect. Eating the right things, making sure that we're using the best products for our skin to make sure that it's nourishing and moisturizing our skin from the for applying body wash and body lotion to our body. We're putting SPF sunblock on our skin on a daily basis to help with making sure that we're not having any premature wrinkles, we're not having any sunspots that come developing on our face or on our bodies. The next thing that I will say is that clothing. Many times that we're not understanding that let me kind of digress. The next thing I want to talk about is the pressure sores. Pressure sores come from pressure from clothing, medical equipment. It can come from bed sheets. It can come from anything that is laying on the skin too long, where it promotes into a redness or a purplish or bluish discoloration of the skin if you are a darker skin. It can come from even from fajas. It can come from our those garments that you have to wear. When you're not allowing the body, when you're not allowing your skin to receive blood flow like it's supposed to, and it's at a stop because it's laying pressure on something too long, it will start developing a pressure sore or a pressure spot or a tenderness or a soreness. That's when you're going into the lane of stage one. There are four stages of pressure sores. There's stage one, stage two, stage three, stage four. Stage one is what I just explained. You're laying on your side for, let's say, 2 hours, 2.5 hours. You get up, you see, let's say you're a darker skin complexion person. You it is it's more difficult to identify that there is a pressure sore that's developing, especially in stage one because the skin is darker. But you will see where it's more bluish or purplish type of discoloration, or if there's a soreness or tenderness, that right there would indicate that, okay, the blood circulation, it has stopped and the tissue is dying. The skin is not able to be fed blood, new blood, because the circulation has stopped because of the constant pressure laying down on a device, on a bed, on anything. So we don't want that to happen. We really don't. We want to be able, we want to be able to where when we are resting, we're resting, but we cannot rest in the same spot as for hours. You will want to keep it within about an hour and a half, and then you will need to rotate, because when you are laying in one spot too long, it stops the blood flow. It stops the skin from being able to breathe and to function like it's supposed to protect, to regulate moisture, to prevent any harm, to prevent the sensory of touch, where you're feeling the touch, but sooner or later, if you keep laying in that area and not rotate like you're supposed to, like you just lay there for, I mean, super long period of time, then yes, you will get it where you start feeling like, wow, it's not as numb. But hopefully you won't lay in that one position that long to that point. But you all have seen your family members, your friends, or heard of people where they were recovering from surgery, or even if it doesn't have anything relating to surgery, where they were laying on an object, just laying in the bed or sitting down, and they laid there and they went to sleep, and they were on it for 8 hours, and they got up and they felt like a soreness or an indentation or redness or bluish or purplish in that area, because that area has actually stopped receiving new blood to nourish that area. So the skin was actually starting to die because there was new blood not traveling to it. So the simplest thing, the simplest of even bed sheets, what I have learned when I was in CNA school is that bed sheets are heavy on the skin. So bed sheets are great, but when it's laying on the skin for so long, it actually start counteracting what love to do, and it start attacking the skin. It start actually breaking down the skin slowly because the fabric is heavier than the skin, and it lays on it for so long. Like you're laying in the bed, it can start actually it will start decreasing the blood flow when you're laying on top of the sheets, or laying on the fitted sheet and you just laying in that one spot for so long. You may start developing a pressure sore. Many times, when you're up and out or moving around, you're not gonna even experience where, oh, I'm having some redness. But when you are recovering from surgery, and when you have gotten 2 or 3 or 4 different procedures done at the same time, like breast augmentation, tummy tuck, tummy tuck, liposuction 360, a BBL. So those particular positions where they're telling you to lay on your side, and you those situations, it is so imperative that you are rotating, that you are repositioning your body every hour to an hour and a half. Even if you are a more heavier person or slimmer person, it does not matter, because you're laying on a bony area, your hip. Your hip is a bony area, and so that is the area where you are prone to developing a pressure sore. So you want to make sure that you are getting up, walking around, having your nurse or nurse aide or family member to check out your skin. Um, Check out your skin every time you get up, between an hour and a half. Make sure that you are hydrating your body with electrolytes. That can be as Pedialyte. I know people are like, oh, that's for little kids. But Pedialyte is actually a really good source of fluids when you are recovering from surgery. Fresh pineapple juice, you can make it yourself, or I go to Kroger's and I get the organic ones. It's like $7. It's pretty expensive, but it's the purest of the purest pineapple juice. And so you want to make sure that you are getting up, walking around, doing your deep breathing, hydrating your body, making sure that you're eating those high nutritious foods that are loaded with vitamin E, vitamin K, all the vitamin B complexes, making sure vitamin C for the brightness and for the complexion. Protein, you want to make sure that you are doing those things, because it's going to help your body not to even respond to a pressure sore being formed in any way, shape, or form. So it's very imperative for those who are, even if you're just having one procedure done per se, saying breast augmentation or breast lift or breast reduction. I mean, you need to be getting up. You need to be kind of getting up out the bed, moving your arms gently, because you don't want to do any type of lifting up high when you had any breast work done, because you don't want anything to tear underneath the breast or on the sides. But you wanna be getting up, walking around, getting that blood flow going, because the blood flow is the foundation of healing. It's the foundation of life. Without proper blood flow, we have a problem. So it's so important to make sure that you are taking care of your skin beforehand. And like I said before, I don't see a whole lot of videos talking about skin health, and that's why I said, well, hey, I'm gonna do one talking about this because it needs to be talked about. It really, really does. That the importance of skin health is has a lot to do with how well you're going to recover, because you don't want to be healing from one surgery and another problem is being created. Pressure sores, you don't want that to happen. Believe me, you do not want to have a pressure sore while you're healing from surgery, because now it's going to go into what? Wound care. So once it goes past stage one, now we got stage two. The ulcer is now being formed. Okay, we don't want that. That means pus is now being formulated. Um, Tenderness. We don't want that to be stage three. It's where it's more deeper. I'm sorry, yes, deeper in stage three, where now it's past. It's now going into the fat area of the skin, the hypodermis, into the thermus area. So stage four. Now we're in the bone area. So it's definitely at a stage where you're going to need packing done with um, with moist gauze going insert inside of the ulcer if it goes to stage four. So I don't want any of you all having to deal with a pressure sore in stage two, three, or four. I want you to stay in a level where you don't even have to deal with stage one. That you're getting up, that you're walking around, that you're keeping yourself fully hydrated with water, infusion water, Pedialyte. Try to stay away from. You can do Gatorade. Gatorade is fine too, but I would say, hey, do Pedialyte. It's actually better versus the Gatorade. But hey, long as you're hydrating your body well, try to stay away from the carbonated beverages because it dehydrates you. Um, and be very cautious of how your garments, your binder is fitting you. It should not be super tight. It should not be. It should just be a snug. It should not be where you're wrapping it around you like a girdle or some like a it should not be, because if your garment is too tight, it's going to create a pressure sore. So we don't want that. You just want it to where it's just keeping everything maintained, and is helping with the reduction of swelling, inflammatory, which is healthy. But if you are walking around, you're doing your deep breathing, you're hydrating your body well, you're staying away from salty foods, the swelling will happen and it will go away. But please make sure that you are not getting extreme with, I need to have the garment super tight around my body. I need to wear a garment that's 2 times smaller than my body. You don't want that, because you're going to create more issues. You're going to create a pressure sore. You're going to create more swelling. So you want to be kind to yourself. Be kind to your body. Be kind that you're on a journey. This is a marathon, not a sprint. And that is what I tell my patients all the time, is that this surgery journey is a marathon, not a sprint. It took you it took a process to get you where you had the decision made, the consultation done, the surgery. Now you have to go through the post-op part of healing. So be kind to yourself, be patient with yourself, and understand that this too shall pass. Um, so I didn't want to go on too long, but I did want to really take the time to do a video about skin health and making sure that you are taking good care of your skin, regardless if you're having surgery, but especially if you're having surgery. Make sure that you are um, being kind to your skin, not being rough with it, making sure that you are, using the right type of soap ingredients, getting the type of soap that has the right type of fatty acids, enzymes in the soaps that will make a difference in your skin, in your moisturizer as well. Making sure that you are eating the vitamin C, vitamin A, vitamin E, vitamin B complex, protein, getting those things into your body, because when you are consuming it and you're drinking your water like you're supposed to, your body is getting the nourishment that it needs. And like I said before, be kind to yourself and know that this is a journey. This is a marathon, not a sprint. And so um, just just enjoy the ride. Enjoy taking every moment of where you are right now in your journey of healing after surgery. Enjoy the moment of you preparing for surgery. Enjoy the moment, if you're not even having surgery, that you're learning about how to take better care of your skin, not just the face, but your entire body during this time, because you just never know. And it's always good just to learn how to take care of self better before when it's a must. You want that. You want to already have implemented those knowledge of how to properly care for my skin, what type of ingredients that works well with my skin, that's going to nourish it, not just glaze on top of it, and then 2 seconds later my skin feels like dry paper. So that's all that I have to say, you all. Thank you for tuning in to this video. Please like, share, and subscribe to the YouTube channel of Post Surgery Care of Atlanta. I do have another podcast episode that's going to be coming up. I want to say in about a week. So definitely be on the lookout for that. It's going to be a great treat. I have another wonderful guest that's coming on, and I'm not going to tell the topic. You all will find out when it's uploaded. But until then, take care of yourself, take care of your skin, take care of your mind, and I will see you all on the next go round.